See, ophthalmic microsurgery, apart from whatever Dr. Ajay just told, is one of the challenges is when you are doing your MBBS, you never are exposed to these sort of skills which you get when you are suddenly exposed as a first year postgraduate to in ophthalmology. Okay, I remember our time when about 20 years back, when there were not wet labs were there only in the premier institutes, including in our institute there was only an old microscope to which we used to attach 2 torches and then tie it with the gauze and then practice suturing under it. And there was no structured program. Whereas now if you go to the West, there's a very, very structured program. Unless you have certain number of hours and credits on a simulator or on a wet lab and they certify you, you cannot touch a patient. Now soon, since we are developing, and we are no longer developing, we are almost developed now, our patients, I was just discussing with madam also, day by day, earlier in India, the concept of wet lab was not very prominent because always you could apprentice. You can just join somebody, you could be an assistant, and you will get hands-on steps immediately. But nowadays, the patients are becoming lesser. The patients who want to be operated by postgraduates are becoming lesser. Even CAM patients have become VVVIP. They are more demanding than our special ward patients. So as we are improving, our nation is improving, standard of living is improving, the cataracts are improving, because improving in the sense, earlier we used to get a lot of mature cataracts. Now we are getting all cataracts in the range of 6-12. So we have to upskill, there's no room for error. So unfortunately, for that, the training is becoming more and more difficult. And fortunately for us, we have got the wet lab and simulation based training, which will help our postgraduates achieve the skills much, much faster than earlier. So when you go to the aircraft, recently there was an article in the paper that Indigo Airlines, they have blacklisted, so the DGCA has blacklisted so many pilots from Indigo because the simulator setting for landing in Mangalore was not good enough. They were working on a simulator which did not simulate the conditions of tabletop or like Mangalore and similar airports. So therefore there was some problem with the retraining. They had to retrain everybody. So it's very, very essential when you're driving for a pilot to have simulation training. Whereas in our place, in ophthalmic surgery, the eye is okay, one eye, it's nothing like that. It's as important as, flying a flight. Only thing is we are dealing with only one patient, but even then that can affect his livelihood, a lot of other implications. So here what happens is, in the West, there are a lot of studies and there are definitely programs which have a stepwise approach to this training before the patient actually meets the patient. Okay, so the challenge of microsurgery, as I just said, there is low tolerance for error due to a small scale of for the ocular anatomy, and the traditional apprenticeship model has its limitations today. So we need to provide a safe, risk-free environment for trainees, and this can be achieved by mainly 2 things. One is a wet lab, another is a surgical simulator. So this is what I will be talking about today. So what is a wet lab? I am not going to tell you too many things because it's there. You're going to see it in the afternoon, the whole session is there. I would want you to actually practice it and then see for yourself. But it is something which mimics the real operating room. You can do the surgeries on animal eyes, including goat eyes here. Porcine eyes are much lesser. It's available but difficult to get, but goat eyes are very, very easy. Cadaveric eyes, which are not used for human transplantation, because if they have enucleated the whole specimen and then you can use that. And there are high fidelity artificial eyes which are available for, I think, somewhere around 50 rupees. You get an eye. For certain types of procedures, you can use that. The other things are, you have to get used to the surgical microscope, the hand-eye coordination, the position which you are sitting. All these things have to be held. And then, of course, as sir was saying, your hand movements, your left hand, your right hand, the dominance, how you move your hands under that. And if you're doing phaco, it's hand-eye foot coordination. So you also have to have your foot moving along the same way. The advantages are, it has a very realistic feel. You can feel the tissue. You can see certain problems. You can try complications. Okay, they say there's something called as, buttonholing. So you see when you're doing a tunnel, what a buttonhole looks like. You can make some errors. You can see how your hand position is. You can see what actually happens. What happens if you go with your MVR too much into the cornea? What's the Descemet detachment? You can plan all that and you can actually do all that on a goat's eye. There is scope for error so that you don't repeat it on the actual patient. Apart from that, to some extent, if you use cost effectiveness is written here, but to some extent it is cost effective because you can use refurbished equipment. You can use, what we are doing now is whatever we are using, the single use blades which we use for patients, we just sterilize them and put it in the wet lab. So there are a huge amount of blades which are available there, which the PGs are then using for the goat side. Our time it was very difficult to get visco. Now whatever is the remaining visco, we just send it out and then they use it there. So in that way it is more cost effective when we compare it to a simulator. Simulators are really expensive and that is a problem. The problem here, limitation, practical limitation, for example, say goat's eye, and I think my postgraduate has made a video which I will be showing here. The practical problem is the goat's eye is not a human eye. So whatever you do and whatever, how much more you practice, it's only your hand-eye coordination which you should get, and you should keep in mind that this cannot be exactly replicated in the human eye. Human eye is much more softer than the goat's eye. So there are some limitations, but it definitely helps in getting a hang of it. The other problem here is you cannot have a goat's eye with complication. You can't have there's some things which you can induce, but not everything. You can, inducing a zonular dialysis, inducing a hard cataract or a soft cataract. Hard and soft to some extent, there are studies which say you can inject different types, different concentrations of formalin and then get that hardness. I have not tried it myself. We do microwave it, but it doesn't work out that well. But some sort of complications you cannot. You have a standard goat's eye. It's only for the initial part which you can help. Mainly it's for your hand-eye coordination. Compared to that, a surgical simulator is much more better. So it's a virtual reality computer-based system. It mimics exactly what you feel, right from the feel to the results which you expect there. You can actually have realistic equipments. You can have an objective assessment. The machine assesses how much more foot pedal you are pressing, how much force you have put in the incision, what would have happened if you go ahead with this, what are the problems in your technique. It flags what are the wrong things which we are doing. So that way you can assess it. From a trainer's perspective, it is very good because you just ask the student to take this module, and in the end of the module, the trainer gets a report card as to this student has got these flaws. Ask him to improve on the hand-eye coordination, ask him to improve on the right hand, ask him to improve on the left hand. All these details will just basically pop up, which we can then individualize and train that particular person. The second thing is you can do hundreds of surgeries or thousands of surgeries. Day and night you can sit. It's like a video game. You can just go repeat. You can't get 100 eyes for practicing. How will you dispose them? How will you get them? Mutton shop fellow will not give you that much because he has to sell his mutton. He can, only what is remaining there he will give you. He cannot get goat's eye for the sake of the eye. So it's difficult to procure that. Here it is much easier. The plastic eyes which are model eyes which are there are good, but they are not very good. I'll just show you that in the end. Compared to that, the goat's eye is much better. But here you can repeat it multiple times and there is no problem at all. All you need is internet and you require electricity. And you can get some non-technical skills. Like for example, as you are operating, there are some programs which are there which can suddenly induce a error. Say you are doing and suddenly there is a PC rent. Now what will you do? The person standing on the side will ask, now what are you going to do? So how the person will respond. All these things can be tested out on a simulator. The disadvantage of that, of course, is, I'll forget all the other things, it's the extremely high cost. The cost is somewhere around 4 crores for an IC simulator, single IC simulator. And we were hoping that some GST rebate will be there. That's also not there. So it's very expensive. In the West, it's a norm, but here it is very expensive as of now. So we'll hope that it becomes, with Fidelis, probably they can bring it much better. I do not know. So when you compare it overall, both have their advantages and disadvantages, and we need a combination of both to help it out. So there is a particular way by which you can have a more hybrid approach, where in first phase you start off with the simulator, basic hand-eye coordination, skills, all those things they can try. There are some games in which you have to mark the dots or something like that under that, because first time you take a instrument under the microscope, it's very difficult to adjust to that, so you can use a simulator for that. And subsequently, you can use for handling the tissue, the wet lab, and then finally you can have complications and other things which are integrated in the simulator with the basic start on the wet lab. So combination of this approach will help in this entire thing to help the student learn cataract or other microsurgery in a better way. Future, they say that by integrating both of the two, we can actually have augmented reality, mixed reality, and we can integrate it with AI, individual person's problems for the individual case complications can be mimicked. As Dr. Ajay just told that before the surgery you have to run it in your mind. Here you can run it on the screen. So you just run it on the screen, you practice the surgery, and you expect what are the problems I might get. Then you approach the patient. So it's for patient safety. Overall, the entire thing hinges on patient safety. So patient's eyes cannot, we try to, of course, complications are an unavoidable part. If you don't have complications, means you're not operated. So you have to have, there will be complications, but at least this will minimize the complications. All right. One more, I think they will be trying it here, where if you are having a good SICS and phaco thing, this is apart from all of this, when you're having a SICS and a phaco thing, a phaco program going together, you can use the SICS nuclei. Usually what happens is we remove the nucleus and we throw it out. Keep the nucleus, keep it in a bottle or something. It will get dry, that's okay. Just keep it there and use that in the animal eyes later on, and you can practice the phacos in that. So that is somewhat a mix of the best way of wet lab. And simulator, if you have a simulator, there's nothing like it. It's always better. Please, Help Me See and other platforms are there which are giving courses. And soon we will be also starting a course which will be much closer to you. So maybe you can utilize that also. So there's a small video about our wet lab which we use. It's been made by my postgraduate, the video. Now this is the main, this is the main setup. So we have a microscope. We have a microscope with a foot pedal that is good for the learning the hand-eye coordination. Phaco machine is there. There's the head. There's a stand for fixing the eyes, goat's eyes. It can also, we have another head which is specifically for phaco. This is the other one. Apart from that, all the instrument trays should be there. There's a microwave which, as I told you, the goat's eyes can be microwaved, not much, it will explode, you have to use it very less. Some other people even give intravitreal. Earlier we used to give intravitreal injection, so practice intravitreal injection first, then do the surgery, but that gives a lot of posterior pressure and you can have a run out rhexis and all that. So these are all practical steps which some tips I can give you. So you want to know how a rhexis will run off, intumescent cataract when you are practicing, give an intravitreal injection and then try to do the rhexis. Very, very difficult. Whereas nowadays they are much smarter. They use these microwaves for 4 seconds or 8 seconds, maximum 8. And then with that they are able to do the procedure. Apart from this, there's also simple things like, the basic things like suture practice, for which there's another microscope there on the edge. And all the you can see some IV bottles there on the side. So these are all the pouches which are there are the remaining solutions which we didn't use for the surgery. Once the surgery is over, we use that, and all the remaining things are used for the wet lab. So apart from that, there's a television connection, so they can actually record what they are doing. As he was saying, as Dr. Kudwa said, you have to actually record every procedure, including your wet lab procedure. To keep a tab on whether our PGs are actually doing the procedure, we expect them to record it and then send us a WhatsApp so that we know that, okay, they have operated. And so if then they are graded on that. So you can do various steps, including peritomy. And these are the basic tissue handling techniques, including tunneling. I am not a very big fan of this. When I was doing my wet lab, this goat sclera is a bit tougher. It is better to do a clear corneal tunnel in the goat's eye, which gives you a feel of a human eye. Because this requires a bit more pressure, but this is how some of my other faculty are training my students. So it's not wrong. You get an idea of the orientation of how deep you have to go and how you are going to keep your hand. And then other things like the injection of the blue and the side port and all that can be done. And then if you have, I think the next one is the rhexis. So all these procedures which are actually done in normal human eye steps, they are repeated or they are repeatable here. So you can actually do the rhexis. All these things have to be recorded also, and you can share it with the consultant for any tips. The goat's eye capsule, if it is not microwaved, feels very much like a pediatric cataract actually. When you're doing a pediatric surgery, it's very elastic. Then apart from this, you also can do phaco. And in the phaco, we can do it in the goat's eye also. But what we have shown you, I just wanted to show you how the artificial eye, which is commercially available, that looks like. So it looks something like this. Only thing is when you're doing, this is the other head which we have for attaching for phaco, which has a drain, because otherwise the fluid will keep draining out. So the problem with this is the nucleus is, you get a feel of the nucleus. It's a sort of a plastic material, but you can't do all the steps in that. So there are some limitations. This is artificial eye. It's not a goat's eye, artificial eye. Doing the rexis and other things here are a bit more difficult compared to the goat's eye. So for some steps here, we can definitely use phaco. So trenching and other things can be done, including sitting position, how you are seeing, and the foot coordination. These things can be helped done with the. So we are planning or hoping for a center of excellence. That's I want to show this. This is Mr. Karthik there, who will be helping you out now. So we have a tie-up with Alcon. So they were helping our PGs do the wet lab practice regularly, and he's a fantastic teacher. I think he will be helping you out. He's already setting up the wet lab there. And that's the Fidelis. That's not the Fidelis. That's the IC, which we are going to get in Manipal soon. By next month, I think we should be starting the program. At least a certificate course in ophthalmic microsurgical skills will be started by us. So I invite all the medical colleges and all the postgraduates who are interested to apply. And as soon as it's done, we'll be circulating the flyers. So you can come and have a course, even if it is, we want a 2-hour course in the evening from 4 to 6 or something like that, we can tailor make it. So you can come and utilize the services. Thank you.